Dr. Teresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, the Minister of Public Services and Procurement, Anita Anand, by video link, the Minister of Innovation, Science and Industry, Navdeep Bains, the Minister of Public Safety and Emergency Preparedness, Bill Blair, et le Président du Conseil du Trésor, Jean-Yves Duclos.
The Treasury Board President, Jean-Yves Duclos.
Dr. Tam, please.
Good afternoon and bonjour. At the end of the day, Monday, June the 8th, there are now 96,244 confirmed cases, including 7,835 deaths and 54,833 cases, or 57% of cases, have now recovered. Labs across Canada have tested 1,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 33,000 people daily. These numbers change quickly and are now being updated once daily in the evenings on canada.ca/coronavirus. As we increase social and economic activities and lift some public health measures, we are doubling down on other public health measures to keep the epidemic under control. Testing and isolating cases, as well as tracing and quarantining the contacts as quickly as possible, is a key part of our control strategy as we move forward to stop new chains of transmission from spreading. Laboratories across the country have been working hard to increase testing capacity, building up equipment, supplies, and people. Across the country, capacity is in place to test more than 60,000 people daily, and laboratories will continue to build on this to prepare for any possible surges in COVID-19. So how do we know we are testing enough? One way is to monitor the percentage of all laboratory tests conducted over the course of the week that comes back positive. We aim for a low percentage positive, below 10%, which is the international benchmark. This tells us that we are casting the net wide to test a lot of people around each positive case, while narrowing in on areas where the virus is spreading. Canada has maintained the percentage positive COVID-19 lab tests below 10 throughout the pandemic, and with a steady increase in testing, this percentage has been continuing to decline. Over the last week, as I said, an average of 33,000 people have been tested daily across Canada, with 2% of these testing positive. These numbers are important for public health and governments at all levels to monitor carefully each week as we monitor the sensitivity of our surveillance and to make adjustments to laboratory testing and epidemic control strategies as needed. Canadians can also play an important role in laboratory testing to detect cases early and stop transmission. We can support friends, neighbors, and colleagues who go for testing, especially those who test positive. We won't always know where the virus will turn up, and we are all in this together. Thank you. Merci.
Okay, thank you very much, Dr. Tam. Et maintenant, je donne la parole.
And now I'll give the floor to Dr. Howard New. Go ahead. Hello. As of end of day Monday, June 8th, there are 96,244 confirmed cases, including 7,835 deaths and 54,833 recovered cases, which represents 57% of cases. Labs across Canada have tested over 1,930,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 33,000 people daily. These numbers change quickly and are now being updated once daily in the evenings on canada.ca/coronavirus. As we increase social and economic activities and lift some public health measures, we are doubling down on other public health measures to keep the epidemic under control. Testing and isolating cases, as well as tracing and quarantining their contacts as quickly as possible, is a key part of our control strategy as we move forward to stop new chains of transmission from spreading. Laboratories across the country have been working hard to increase testing capacity, building up equipment, supplies, and people. Across the country, capacity is in place to test more than 60,000 people daily, and laboratories will continue to build on this to prepare for any possible surges in COVID-19 as we move into the fall. How do we know we are testing enough? One way is to monitor the percentage of all laboratory tests conducted over the course of the week that come back positive. We aim for a low percentage positive, below 10%, which is the international benchmark. This tells us that we are casting the net wide to test a lot of people around each positive case while narrowing in on areas where the virus is spreading. Canada has maintained the percentage positive COVID-19 lab tests below 10% throughout the pandemic, and with a steady increase in testing, this percentage has been continuing to decline. Over the last week, an average of 33,000 people have been tested daily across Canada, with 2% of these testing positive. These numbers are important for public health and governments at all levels to monitor carefully each week as we monitor the sensitivity of our surveillance and make adjustments to laboratory testing and epidemic control strategies as needed. Canadians can also play an important role in laboratory testing to detect cases early and stop transmission. We can support friends, neighbors, and colleagues who go for testing, especially those who test positive. We won't always know where the virus will turn up, and we are all in this together. Thank you.
Merci beaucoup, Dr. New.
Thank you very much, Dr. New.
Minister of Public Services and Procurement, Anita Anand. Anita, please.
Thank you, Christia. Good afternoon. I will start today by acknowledging and thanking my provincial and territorial counterparts in procurement for their dedication and collaboration throughout this pandemic. We have spoken regularly since the beginning of this crisis to ensure that our approach to this historic procurement endeavor is coordinated and effective across the country. Au moment où les
As the restrictions are gradually lifted, it is even more important to provide frontline healthcare workers the equipment that they need, and we must work together so that we can do so.
Now for an update on deliveries. In keeping with our approach from 3M at a rate of approximately 500,000 per month. In terms of mobilizing industry, we have signed 26 domestic contracts, and I want to thank Minister Navdeep Bains and his team for their work on this front to mobilize Canadian industry. Overall, we are meeting the need when it comes to the procurement of PPE at the federal level as we supplement the procurement efforts of the provinces and territories themselves. And Canadian companies are now leading in our pandemic response on several fronts, while sustaining and creating jobs across the country. Their contribution is proving to be essential in fighting COVID-19. Par exemple, à ce jour,
For example, to date, we have received 13.8 million face shields, half of which have been manufactured here. We have now received more than 6.6 million liters of hand sanitizer, coming mainly from Canadian manufacturers. Moreover, We have received more than 100 million masks and 34 million pairs of gloves, as well as 4 million gowns.
Approximately 160 ventilators have been delivered and are being inventoried by the Public Health Agency of Canada. Finally, we have distributed more than 2.7 million N95 respirators to the provinces and territories. Moving now to new contracts. We continue to sign new contracts focusing on domestic manufacturers tapping into the ingenuity and the tenacity of Canadian companies to see us through the pandemic in the short and the long term. I am happy to announce that we have signed a contract with Joseph Ribkoff, a manufacturer based out of Dorval, Quebec. They will provide us with 1.2 million made-in-Canada gowns, with deliveries starting in July. We have also signed a contract with the Stevens Company, a distributor based in Brampton, Ontario. They will be supplying us with 15 million shoe covers, as well as 5 million disinfectant wipes, all of which will be made right here in Canada. These domestic contracts are important as we continue to build multiple, diversified supply chains for Canada's benefit now and into the future. Now for an announcement. We know that as we move forward, access to PPE will be essential to Canada's recovery. Restrictions are easing across this country in one form or another, and business owners, organizations, and all Canadians want to know how they can find the right PPE for their own circumstances. I am pleased to announce that we are taking action to meet that need to find information about PPE. Today, we are launching the Government of Canada's PPE Supply Hub to bring together available resources and information for organizations that are buying and selling personal protective equipment. En ligne donne, entre autres,
This new online tool provides reliable information that is based on guidelines published by the Canadian Centre for Occupational Health and Safety with regard to the type of equipment and individual personal protective equipment to ensure employee and customer safety. It also helps match sellers and buyers of PPE on the Canadian market.
Broad collection of important resources, including web platforms launched by provinces and territories themselves, and those stemming from the private sector also, such as the Rapid Response Platform that has, to date, successfully matched PPE buyers and sellers more than 34,000 times. The Supply Hub also includes consumer information for any Canadian who wants to buy PPE to help to inform their buying decisions. This new tool is available to all Canadians, and I invite you to visit the PPE Supply Hub at canada.ca/coronavirus. Over time, we will continue to expand and enhance the Supply Hub with new content. I would like to thank the Supply Council and my provincial and territorial counterparts for their important input into the Supply Hub over the past weeks. We will also continue to work with provinces and territories and industry to ascertain additional means of support and ways that we can help Canada's PPE needs. This announcement is an important step in assisting Canadians with their PPE needs as our economy reopens. As demand for PPE goes up, Canada is keeping up. In closing, nous avons un message pour...
We have a message for our healthcare workers, as well as for all Canadians. As we begin a new step in our response to the pandemic in Canada, I can assure you that your safety remains our absolute priority. This situation concerns all of us, and we are there for you.
Merci beaucoup. Thank you so much.
Okay, thank you very much, Anita. And now we will hear from our Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Thank you very much, Christia. As Canadians continue to deal with this unprecedented crisis, they can take comfort knowing that thousands and thousands of Canadian companies are stepping up to help. Innovators from across the country have proven that Canadian know-how and thinking outside the box can lead to exciting and promising discoveries. We've seen this play out many times during the past few weeks. From using construction house wrap as a Health Canada certified alternative material for medical grade gowns, to bringing together a coalition of Canadian manufacturers to design and produce multiple made in Canada ventilators, to sourcing and studying potentially groundbreaking point of care test kits through our Innovative Solutions Challenge. Les innovateurs, les chercheurs,
Innovators, researchers, and others are ready to take on the challenges that present themselves.
the call under the Innovative Solutions Canada initiative, this time through the prototype testing stream for both medical and non-medical solutions. We asked for creative made-in-Canada technologies to address the COVID-19 pandemic and similar public health emergencies. And the response has been absolutely amazing. In just 2 weeks, we've received 562 proposals from innovators across the country. Tous les ministères.
All the departments and government agencies have access to cutting-edge innovative prototypes. They will be able to test them as they see as most relevant to their efforts.
Testing will be eligible for contract awards to support the efforts to bring these innovative prototypes to market. As you know, we've been working with Canadian companies to retool and scale up production of necessary material components for COVID-19 testing. As we've said before, it will be critical moving forward that we secure domestic capacity for components needed for widespread testing. That's why I'm pleased to announce that we progressed from a letter of intent to a signed contract with Ontario-based GL Chemtech to produce and supply a chemical that is absolutely necessary to perform COVID-19 testing. Guanidine thiocyanate is neither easy to pronounce nor easy to produce. Nous devons viser l'autosuffisance et être en.
We must be self-sufficient and be able to obtain this chemical that is in high demand here at home.
Manufacturers we have worked with who are now producing medical gowns. We now also have a contract in place, as mentioned by Minister Anand, with a women's apparel designer, Joseph Ribkoff. They will manufacture medical grade gowns from their headquarters in Montreal. Canadian companies have also significantly stepped up to produce face shields. In addition to over a dozen companies retooling to produce more than 40 million face shields, including companies like Bauer and Burloak, we again are turning to Canadian companies to meet this need. So I'm pleased to share with you that we have posted a request for proposal seeking made in Canada shields, face shields, and this is a positive development. It means that we have created enough made in Canada capacity to meet our needs for face shields from Canadian companies. We often talk about finding opportunities in a crisis, and we're seeing so many willing partners coming together to help their fellow Canadians during this uncertain period. Together, as we continue to move forward to develop made in Canada solutions, I know we will come out of this together and stronger. I look forward to updating you again on more good news in the near future. Thank you very much. Merci beaucoup.
Thank you very much.
Thank you very much, Nav. And now we will hear from our Minister of Public Safety and Emergency Preparedness, Bill Blair. Bill, please.
Thank you very much, Deputy. Good afternoon, everyone. No segment of Canadian society has been untouched by COVID-19, and that includes the inmates and correction workers who are daily in our federal corrections system. Staff in the correction facilities and federal inmate populations have faced an increased risk and unique challenges in the fight against COVID-19 because of the closed environment of our institutions. Correction Services Canada has worked very closely alongside the Public Health Agency of Canada and local public health authorities to best protect the health and the safety of staff, inmates, and the public. And over the course of this pandemic, COVID-19 has spread throughout some of our institutions, and we have responded. In all of the infected institutions, staff, in partnership with public health and local health authorities, have conducted workplace health and safety audits, infection control and prevention audits. They've ensured that all inmates and all staff have access to appropriate personal protection equipment. They've retooled their work programs within the prison system to become self-sufficient in the development and production of personal protection equipment. There have been medical services and supports provided to those who required it. Testing and tracing has been effective and comprehensive in all of these institutions. And as a result of all this extraordinary work between our corrections staff, the Public Health Agency of Canada, and local public health authorities, that as of today, there is one active case of COVID-19 in our federal corrections systems. Over the past 3 months, there have been 360 confirmed cases. And then I want to acknowledge that 2 inmates did pass as a result of complications from COVID-19. And these deaths are deeply troubling, and they motivate us and inspire us to continue to work hard to protect all of the people living and working within these federal institutions. As a system focused on rehabilitation and effective reintegration, it is important to remember that our correction system often extends well beyond the walls of our federal institutions. Community-based residential facilities, more commonly known as halfway houses, are a critical component to this process. National voluntary organizations support the operation of many halfway houses across Canada. They work with offenders when they're ready to transition into a supervised community living environment to make sure that they have the support that they need to be successful based on each person's individual and unique needs. The work of the National Voluntary Organization is an extremely important component of our correction system. And during the COVID-19 pandemic, they have seen significant and increased demand for their services. We have been fortunate. They have adapted quickly. They've built new partnerships and changed the way that they normally operate to find creative solutions to respond to the crisis. They require and deserve our support for this important work. And that is why today I am very pleased to announce that the Government of Canada will provide up to $500,000 to 5 national voluntary organizations. These include the Association de Réhabilitation Sociale du Québec, the Canadian Association of Elizabeth Fry Societies, the John Howard Society of Canada, the National Associations Active in Criminal Justice, and the St. Leonard Society of Canada. This funding will support the development of pilot projects to help these organizations to adapt while they reintegrate offenders under their supervision. It will also help to explore and assess practices that they have already implemented to reduce the spread of COVID-19 so that our institutions can implement more robust infection prevention protocols going forward. Halfway houses will also now be able to submit COVID-related expenses to Correction Services Canada for reimbursement, allowing them to focus on maintaining healthy environments for their residents. The Government of Canada is proud to be a partner with these national voluntary organizations. I'd like to take this opportunity to thank them for all they do to provide safe, secure, and supportive environment for offenders serving time in the community. Their important work creates better outcomes for offenders, and it helps keep Canadians safe. Thank you.
Thank you very much, Bill. Et maintenant, je donne la parole au Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
The President of the Treasury Board, Jean-Yves Duclos, has the floor. Hello, everyone. Welcome. We have some important news today. First of all, as Mr. Blair just said, there will be investments to protect officers and people working in correctional service institutions. There will also be money to help organizations who help with their transition, the transition of offenders to the community. These are major investments in the context of COVID-19. Second of all, we've heard that there are good results with regard to the supply of PPE, always collaborating with and supporting with the provinces and territories. And third of all, as the Prime Minister said,
with opposition parties on continuing to support Canadian families and Canadian workers in a context in which the economic situation still requires both income and job support. So we are having fruitful and collaborative discussions with opposition parties on matters of providing the important assistance that we announced last week when it comes to supporting people living with disabilities, but also in terms of making the CERB in particular even more complementary to the important emergency wage subsidies, making sure that the CERB continues its vigor and its rigor in assisting the millions of Canadians in difficulties, but who are increasingly seeking to return to work in a safe environment, and as well as ensuring that all Canadians understand that this is made in a rigorous manner designed to protect the integrity of Canadian taxpayers. So that would be my brief summary, Chris.
And now we're ready to answer your questions. Carl, s'il vous plaît.
Thank you, Deputy Prime Minister. As usual, we'll start with 3 questions on the phone before turning to the room. So one operator, over to you.
Star 1 on your telephone keypad. Si vous avez une question, faites étoile.
If you have a question, press star 1 on your keypad.
Justin Ling from Freelance. Please go ahead. Your line is now open.
Hi, good afternoon. This is for Minister Blair. Since the start of the pandemic, and obviously long before that, there have been calls to start releasing nonviolent and low-risk inmates. This whole pandemic, everyone from human rights commissions to the correctional investigator to Indigenous groups to many, many other organizations have said that that is a step that needs to happen. Obviously, those calls were also part of the Truth and Reconciliation Commission and the Missing and Murdered Indigenous Women and Girls inquiry. Yet, even today, it doesn't seem like that is part of a priority for you. What is holding you back from looking at the inmates who are currently in federal custody and ordering the release of those who don't pose a risk to the public?
Well, thank you very much, Justin, for what I think is a very important question. And first of all, I'd begin by answering that our first priority in all decisions with respect to the release of federal inmates into the community is our first priority is always public safety. And I know we work very closely with the Canada Correction Services, as well as the Pro Board of Canada, to ensure that people who were eligible release were expeditiously dealt with, because we recognize that crowding in our prisons and the potential risk of in the prisons through the COVID-19 epidemic was significant. I can advise you that the federal custody population since March the 1st has now declined by a total of 713 inmates. And so that's a net reduction of the inmate population of 713. I will tell you that's quite significant and unprecedented. It's a direct result of 2 things. Excellent work by Correction Services Canada and the Parole Board of Canada in expediting and dealing appropriately and quickly with people who were eligible for release so that they could be safely reintegrated back into the community. And it's also important to acknowledge that as a result of work that's being done in our provincial institution, our provincial courts, we've seen fewer people coming into the federal system as well. But we also recognize, Justin, that there are a number of people for whom it is not safe to release back into the community. And that's why the work that Correction Services Canada has done in partnership with the Public Health Agency of Canada and local public health authorities to ensure a safe environment for those inmate population and the people working in that prison had a safe and healthy environment to work in. And so those workplace health and safety audits, the infection control and infection prevention audits, the work of ensuring that everyone had access to appropriate personal protection equipment, the work of our medical and health staffs and working with the local health authorities, and the testing and tracing that has taken place have all been very important and very effective in maintaining a safe environment for those people in our federal institutions that were not eligible for early release.
Mr. Ling, follow up.
Yeah, so just quickly, I mean, you said that those numbers are unprecedented. Of course, around 600 inmates are released due to statutory release every month anyway. So, I'm not quite sure whether or not there's additional releases going on above and beyond that number that you want to fill us in on. But beyond that, obviously, there's a broader conversation happening right now about systemic racism against Black and Indigenous people in the justice system and policing. Do you think systemic racism is a factor in the fact that Indigenous and Black Canadians are wildly overrepresented in federal in federal prisons?
Yeah, Justin, I would acknowledge that within all of societal systems, within the justice system, but also our mental health system, other health systems, the education system, employment systems, there are disparate outcomes, and which reflect, I believe, a social injustice that does exist in our society. And that's one of the reasons we as a government have been working so hard to address those disparities and to create greater fairness. But if I may speak specifically to the criminal justice system, let me also be very, very clear that discrimination on the basis of race or any other form of bias is not only abhorrent and unacceptable, it's unlawful. It's contrary to the Charter of Rights and Freedoms. It's contrary to the Canadian Human Rights Act. It is something that cannot be tolerated within policing or corrections or any aspect of the justice system. It's one of the reasons that we have put in bias-free policing policy for the RCMP, and through their training and hiring, I think it needs to be very clear that it is unacceptable, and that we will not just simply denounce it, but we'll work hard to eliminate it within all of the disparate and socially unjust systems that exist in Canadian society.
Merci, Monsieur le Ministre. Opératrice prochaine.
Thank you. Next question, operator.
Thank you. Merci. La prochaine question est de Lina Dib de la Presse canadienne.
Following question from La Presse Canadienne. Over to you. Question.
Continue along the lines of what Justin was asking you about. So I don't know as much as he does from this file. So could you explain to me that 713 number that you gave? How many of those were actually released because of the pandemic to avoid them catching COVID-19 in prison?
Let me thank you very much for the opportunity to clarify. When I said that the prison population has declined by 713 inmates, I mean in the net. And as Justin indicated, and he's correct, approximately 600 people come into the system each month, and a very similar number, about the same, go out. And so on average, we have about 14,000 people at any given time within our federal institutions. As a result of work done during this pandemic, we have seen that number of 14,000 reduced in the net by 713, which means 713 more people have been released than entered the system.
Okay, and so I do understand that that number is people that were released because of the pandemic.
No, ma'am. Let me be very clear. No. Because I want to make sure that I'm very clear with you. The Parole Board of Canada and Correction Services Canada makes decisions about the release of people into the community each and every day from our federal institutions. That is always based on very clear legal criteria and a determination of the health concerns or safety concerns of the communities in which the people were released, and also to ensure that people are released in such circumstances that they are likely to be successful in their reintegration and not to reoffend. And so that's one of the reasons I mentioned earlier, the support that we're providing to the national voluntary organizations who do some great work in helping people reintegrate safely and successfully back into society. And so that work takes place on an ongoing basis. We also recognize the importance of that work, and so the Parole Board of Canada, for example, has had extra staff on. They've been working weekends to deal with those individuals who are eligible for release and who perhaps for a number of reasons may be at greater risk during this pandemic. And so their work has proceeded according to all of the rules. We're not releasing people for whom it is unsafe to release, but they have been working expeditiously to ensure that for those who are eligible, that happened in a quick and efficient way. And we've also, and so a number of measures I'll share with you, for example, from an individual entering into an institution from a community where the virus was present, those individuals are tested before they enter into the institution. And for prisoners who are being released back into community, they're also tested to make sure that their reintegration in society can be done safely. And we work very closely with the local public health authorities to protect the health and safety of the inmates, the workers, and the communities in which these offenders are released.
Est-ce que je peux avoir ma deuxième question?
May I ask my second question to Mr. Duclos? Of course. Thank you. Earlier, Mr. Trudeau said that there was a natural process that gradually, for example, the CERB would be transitioned to the wage subsidy, people receiving the CERB. Will there be any particular measures or ways of convincing people to move towards this wage subsidy? So far, it hasn't been the success that you hoped for. Are you expecting this to just come about naturally, or will you be doing something in particular to encourage businesses to take advantage of the wage subsidy? Answer. This has to do with diversity and effectiveness. Mr. Trudeau said that there's a wide range of circumstances in Canada, in Quebec. Many workers would like to find a job but can't find one. There are workers who will be returning to work soon and would like to have the health conditions and the incentives to be able to do so. We need to recognize then that there is a wide range of contexts. The return to economic recovery in the long term requires effective measures, even if in the beginning the CERB was perfectly indicated at the very beginning of the crisis. We are now realizing that it's less and less useful and less appropriate to an economic recovery context. That's why it was announced this morning that we will, in the coming weeks, continue to evolve based on our assessment of the situation. Thank you, Ms. Minister. Next question, please.
The next question is from Stephanie Levitt from the Canadian Press. Please go ahead. Your line is now open.
Good afternoon. My questions are both for Minister Blair. First off, Minister, I wonder if you could talk about whether or not you see any value in police wearing body cameras and what the pros and cons of that might be.
Yeah, thank you, Stephanie. In my experience, I think transparency and accountability are very important to maintaining trust between the police and the communities that they serve. I also know from some experience that video evidence can be the best possible evidence to give us all and the public a better understanding of exactly what transpired. I've been involved in a number of pilots in which body cams have been used, and I think it's important to recognize that there are a number of significant considerations, and not all of which are technical. Certainly making sure that the cameras are of good quality and of adequate battery life, and uploading the data into a secure environment is all important. But there are also serious considerations, policy considerations with respect to the privacy concerns of Canadians, and so all of that work is important. But I believe that the presence of video evidence, as can be made available under the right circumstances, following the appropriate policies, respectful of Canadians' privacy interests, that video evidence can provide the best possible evidence to help inform exactly what transpired. It is also an important tool of accountability. Because police possess extraordinary authorities in our society, and they must be held to account for their conduct, and the body camera can provide the evidence to enable that to take place effectively.
Stephanie, follow up.
Yeah, thank you. A few minutes ago, you talked about the bias-free policing policy within the RCMP, but in the last couple of days, we've seen recent instances of what appear to be the RCMP mishandling calls involving Indigenous people. I mean, your colleague Mark Miller used the words, he's outraged and pissed off about what he's seen. So what are you going to do about it?
Yeah, I think it's a very important question. And I have to tell you, the relationship and the service that in the policing services in Indigenous communities, clearly that there is work to be done, and frankly, I share Minister Miller's concern that individuals who engage in misconduct and don't do their jobs properly need to be held to account. And at the same time, I do recognize the importance of those policing services in those communities. And it's one of the reasons we'll be working very closely with Indigenous communities to develop a new legislative framework for the delivery of policing services, to make those police services more accountable and more under the control of Indigenous communities. It's an important dialogue that's taking place, but we're absolutely committed to providing every part of this country with professional and culturally competent policing, but also policing that is worthy and trusted by a community to provide those services in an appropriate way, in a bias-free way, in a professional way. And so I do not in any time accept any potential misconduct of police officers. I think that their accountability is important, but it's important also that there be systems of oversight and accountability to ensure that that's done properly.
Merci, Monsieur le Ministre. On va maintenant prendre les questions.
Thank you, Minister. We'll now take questions from the room.
Tam, Mackenzie Gray with CTV News. Yesterday, the WHO said that asymptomatic transmission of COVID-19 was very rare. And about an hour ago, they have come out and walked that back. I would like your opinion on what and how big in a role that asymptomatic transmission plays with the virus right now. And Ms. Freeland, in the same vein, the WHO has made what would be quite a large error in coming out and saying that it was very rare and then having to walk it back in the same day. And there have been a number of questions about the organization and how it's been run, specifically on health information that comes from the WHO. Should Canadians trust the information that they are putting out?
So we learn about this new virus every day, but it is clear that there are asymptomatic cases, first of all. And depending on the studies that and which populations have been studied, asymptomatic people can represent a significant proportion of cases. Of course, some of them are actually mildly symptomatic or what we call pre-symptomatic as well, but there's definitely asymptomatic cases. Studies on transmission of the virus from asymptomatic cases are not very easy to do, but there are studies that have shown that transmission of the virus from asymptomatic people can occur. Now, I think what is still undergoing evolution in terms of the information is to what extent. So that there are definitely studies that shows it does. But the other thing that we know is asymptomatic cases appear to have the same amount of virus in the back of the nose as people who are symptomatic. And this, together with some of the information to date on the transmission potential, is why we have evolved our policy to take into account that this possibility, including, for example, the wearing of masks when you can't maintain the physical distance. So that is our knowledge to date.
And let me just say, Mackenzie, I think Canadians should keep on doing what they've been doing, which is to listen to and to trust first and foremost the medical advice of Canada's medical experts, of the public health officers in Canada. And the more local, the better. Canadian public health officers across the country have been working really, really hard. We have a vast and diverse country, and conditions are very, very different across our country. Local public health officers are really, really focused on what is going on in their province, in their town, in their city, in their region. And I think they are giving Canadians excellent advice. And of course, one of the great things about the Canadian medical community is how well connected it is with peers and partners around the world, and how carefully Canada's medical experts plug into that information and share it with us in ways particularly appropriate to and informed by the situation here on the ground at home.
My second question is for Mr. Blair. There have been a number of high-profile incidents recently between the police and Canadians who are racialized. In Ottawa, there was a bylaw officer who punched someone in the face for a social distancing ticket. A black woman falls off her balcony in Toronto. The RCMP in Nunavut hit an Indigenous man with his car. We could go on. Why do you think that these issues that police have, usually involving substantial amount of force or potentially someone dying, almost always involves someone who is a racialized Canadian. And further to that, one of the ways that the protesters across the country have been discussing ways to deal with that is to what they call defund the police, where they take a portion of the police budget and put that towards communities who are marginalized to help them with social services. Do you think that is an idea that the federal government should implement?
Yeah, thank you very much. And these are important questions and important discussions that are taking place right across Canada. First of all, let me be really clear. I will never defend the indefensible, and where someone appears to exceed their authority or use excessive force or act in a discriminatory way, that needs to be held to account. There are processes and oversight mechanisms to ensure that happens, and those things are important, and we continue to support them. And at the same time, I also recognize, the concerns that when people say that we need to do better in communities, when we need to address an addiction, when we need to address the history of abuse and mistreatment and the generational trauma that comes from that we need to address inadequate housing in our communities, that I agree completely. And I think those are things that as a government, as a country, we need to look at all of the conditions that give rise to social injustice in every place in our country and do a better job. And we're absolutely committed to doing that. I will also say, because I've been involved in policing personally for a long period of time, that it's not a zero-sum discussion, that every part of the country also deserves professional and culturally competent, accountable policing services. But every part of the country also needs to ensure that we address those social conditions that give rise to injustice, that give rise to disparate outcomes, that cause people to suffer. And so the work of supporting Canadians in every part of our country, and particularly racialized Canadians, Indigenous Canadians and racialized Canadians in all parts of this country, we need to do a better job of providing them support and helping their kids be successful, their communities be safer, and we have to ensure that the police that are there to serve and protect them are culturally competent, capable, professional, and accountable in how they perform those duties.
Thank you, Minister. Olivia?
Good afternoon, Olivia Stefanovich, CBC News. Minister Blair, I have two questions for you. The first one has to do, again, with body cameras. I'm wondering if you can be very specific about who is going to pay for these body cameras, where is this money going to come from, how much are we talking about, how much money, and do you have a timeline as well for when we can see these roll out?
Yeah, thank you very much. I think it's important to recognize that responsibility in police jurisdictions are different right across the country. Policing generally and delivery of policing services is under the responsibility of the provinces. And most police officers, more than 65% of police officers in this country, actually are municipal police officers working for police services boards and municipalities across the country. And so the police that we are responsible for are those RCMP officers working particularly in First Nations, Indigenous and territorial communities. And so we are absolutely committed to moving forward on that, as the Prime Minister has indicated. I've had discussions with the Commissioner, but the Prime Minister has also indicated, and I'll be following up on this, in discussions with the provinces and territories, but also with municipalities across the country to develop strong policy frameworks to ensure that this technology and other technologies are always respectful of Canadians' privacy rights, but do the job of creating greater accountability. And so I've had some discussion with the Commissioner of the RCMP. They've piloted body cams in a number of different environments. We're working on the policy framework that would support their use, and we'll move forward as quickly with that as we're able. I don't have a specific time frame, but we are absolutely committed to creating a better and safer, a more accountable environment in the communities that we serve. And at the same time, we'll work closely with the provinces and territories and municipalities across the country to enable them to do the things that can ensure that they're providing appropriate policing services for the people they're responsible for.
Minister Blair, were you informed of the arrest of Liberal MP Marwan Tabera when it happened back in April, or did you find out through media reports last Friday?
I found out through your media reports. I had no knowledge of it prior to that.
Does that mark a breakdown in communication? Well,
again, I think there is a responsibility on every member of this House to bring such information forward. That information about the charges being laid were not brought to our attention until the member did so. I think every member has that responsibility to report to this House and to their leader the circumstances that they find themselves in. I only became aware of that when the media reported it.
Merci, Monsieur le Ministre. We're going to take
Thank you, Minister.
operator.
Thank you. Merci. La prochaine question est de Marie Vastel.
Next question from Le Devoir. You have the floor. Good afternoon, Mr. Duclos. I'd like to go back to today's announcement, or the announcement of a bill to come to punish fraudsters who are using the CERB fraudulently. I want to know if, I want to make sure you're not going to punish honest mistakes, that you're truly going to publish fraudsters. Could you please let us know how you'll be able to distinguish intentional cases of fraud from others? What will be the mechanisms used? Answer. Thank you for the question. I'd like to say that the large majority of Canadians, as we know, are honest people. It can happen in an emergency, as we've been going through these last few weeks, that honest people make errors in good faith. Particularly in the month of April, the context was very difficult for millions of Canadians who believed that they would not be receiving support. There could be some confusion between the CERB and employment insurance, for example. So tens of thousands of Canadians applied to receive both. That's an example of an honest mistake. There could also be errors that may initially not have been errors, but that turned out to be them later, once applicants receive more information on a certain program or on their own circumstances. The large majority of people then are honest. The proportion of people who made errors in good faith is small, is modest rather, but nonetheless a large number, and we are working on that. As has been said in the media, there have also been cases of fraudsters who are taking advantage of exceptional circumstances to gain the system. Service Canada agents and the Canada Revenue Agency agents know very well how to trace these cases of fraud. We knew at the beginning that there would be some cases of fraud. Currently, we're in discussion with the opposition parties to allow CRA agents and officers to identify and correct these cases of fraud. We've received very clear signals that if anything has been done fraudulously, not in good faith and not honestly, that this fraud will be subject to major penalties. Follow-up question? Question. I just wanted to know what these mechanisms are, these well-established mechanisms that you'll use. Are you talking about automatically excluding people who made 2 applications? I'd like to have explanations if you have them. And
you have a more informational answer to provide. The Army deployment in Quebec and Ontario long-term residences is supposed to end on Friday, June 12th. Can you give us an update on whether they will stay longer in one of both of those provinces, and until what date?
J'aimerais rapidement
answer from Mr. Duclos. First of all, I'd like to give you all those details of the various mechanisms. They're too complicated, though. You'll find details on the CRA website, rather, and on Service Canada website. We need to take into account the wide range and the complexity of cases.
And with respect to the request for assistance from Quebec, back in early April, when Quebec contacted us and requested our assistance responded rapidly and positively, and we used the Canadian Armed Forces to deploy, and over 1,000 Canadian Armed Forces members have deployed into those long-term care facilities in Quebec. And I take the opportunity to acknowledge, I think they've done an extraordinary job in creating a safer environment and helping protect the health and safety of Canadians. We continue to work very closely with the province of Quebec, and you know, the problem has not abated, and there are still significant concerns in the long-term care facility, and so we're bringing additional resources to the issue, and we've been working very closely with Canadian Red Cross, and we have developed a working plan, and we've funded the Canadian Red Cross to provide additional resources and additional services in the long-term care facilities in Quebec. And so we are working towards, with the province of Quebec, a combination of Canadian Red Cross volunteers and workers, and as well as Canadian Armed Forces workers, to continue to provide the support that Quebec has asked for and requires. And it's very much a collaborative effort as we're working between ourselves and the province of Quebec to ensure that they receive the help that they need. The protection and safety of Canadians in those long-term care facilities is our priority, and we'll continue to work hard with Quebec but with the Canadian Red Cross, and ultimately we want to maintain a sustainable response to the request for assistance received from Quebec.
Thank you, Minister. Ceci met fin à la conférence de presse.
That ends our press conference for today. Thank you, everyone.